this is the IFC and Premod practical. First thing you want to do is make sure you have your pads. Next thing is make sure the machine's plugged in. Check if it's plugged in GFI. You want to check the calibration of the machine. Make sure it's calibrated at least within the last year. Then you want to go ahead and grab your wires. Make sure they're not frayed at all or have any cuts or anything in them. And then after that, you want to go ahead and you want to verify that it's your patient that you're doing treatment on. You want to make sure they're in a comfortable position. You want to make sure that the area of treatment is visible. You go ahead and then check for light touch perception. You check for pulse and capillary refill. And you go ahead and you also check for contraindications like rash or open wounds or anything. And then go ahead and turn the machine on. And while the machine's turned on, you can ask the patient if they've ever had stem before. Okay. So first, you want to click electrotherapy, and you want to go ahead and click the Premod. Go ahead and hit edit, and you leave sweep on, continuous cycle. You switch it to CC instead of CV. And then you can go ahead and you place the pads. Premod you're only using 2. You want to make sure the pads are sticky. If not, you can run some water on them, or you can put them up against the hydrocolator. If you have any issues with them sticking, you can pre-wrap on it. You want to make sure you have the correct line or channel. So for channel 1, make sure red goes towards the heart, and black goes towards the ground. And then you can go ahead and you can start turning it up. You'll ask the patient to let you know when they start feeling it.
Okay.
And then after they tell you they can feel it, you want to ask them to let you know when it gets to an intense feeling but not pain. Okay. Then go ahead and hit start, and then while the treatment's going, you just want to check with the patient, make sure treatment's going okay, if it needs to be turned up or turned down. Didn't say this at the beginning, but you want to make sure you grab a towel just in case you have a heat pack or an ice pack. That way, the area can stay dry. You can clean up any water. We'll go ahead and stop this. You want to make sure the machine's zeroed out. And then you go ahead and take the pads off. And then while you're doing this, you want to make sure you can put them away, take the cords out. Ask the patient how the treatment felt. You want to go ahead and check the treated area to make sure there's no adverse reactions. You want to record your parameters and then ask the patient if they have any questions. And then for IFC, it's the same setup as Premod, except you're going to use 4 pads. Go ahead and hit electrotherapy. You can hit inferential, and this will just be a little bit deeper. You want to use 4 pads. You surround the area that is having the pain. Alright, again you want to make sure red goes towards the heart. You want to make sure your channels are diagonal from each other. And then again, you can hit edit, you leave sweep on, the hertz and stuff alone, you can change it to CC again. And you go ahead and you start turning it up, and then ask the patient to let you know when they start to feel it. Okay, and instruct them, then when it starts to feel more intense but not painful, to stop.
That's good.
Then go ahead and hit start again. Again, you check, make sure with the patient if the treatment's okay, if it needs to be turned up or turned down at all. And go ahead and hit stop. Make sure the machine's zeroed out. And go ahead and remove the pads. And in the process of removing the pads, again, you just check to make sure there's no adverse reactions from the treatment. And you would ask the patient how the treatment felt. And then you would just record parameters and then ask the patient if they have any questions.